I'm Athene and I'm based at the University of Bristol and have been the trial coordinator of the ProtecT trial of treatments for localised prostate cancer. ProtecT is an effectiveness trial comparing for localised prostate cancer, radiotherapy, surgery and active monitoring. It's very important to measure patient-reported outcomes, and this is the first trial to effectively compare them using robust and validated measures. It's also important to measure these prior to treatment effects so we can see in detail what the effects are of those treatments. And this is what this paper reports upon, the effects, quality of life and symptoms in men prior to treatment. In general, when we looked at urinary, sexual function, bowel function, depression, all these symptoms were quite low, although anxiety was somewhat raised, probably due to the diagnostic process. It was also noticeable, however, though, that a third of the men reported sexual function difficulties and that this was increased as the men got older. In doing this study, we always chose well-validated, robust measures such as the EPIC questionnaire and the SF-12 for general quality of life. The EPIC questionnaire was used for symptoms. And in this way, we saw that when we compared to general men of a similar age from a community-based population, the level of symptoms and overall quality of life were quite similar. And this is not surprising given that the men in the ProtecT study were identified from the community using prostate-specific antigen testing. These results are very important because they lead into the overall outcome papers of the ProtecT trial, which have now been published recently in the New England Journal. And in those outcome papers, we have both the clinical and the patient-reported outcomes. And for the first time, men are able to compare, and clinicians, a robust comparison of both the clinical and the patient-reported outcomes for both radiotherapy, surgery and active monitoring, and assess the trade-offs needed to compare these different types of outcome. And then finally, I should mention that the study, the ProtecT trial, has been funded by the UK NIHR Health Technology Assessment Programme.